Welcome to the Dr. Carniol Show. I'm Dr. Paul Carniol. With me is my co-host, Tara Calley. Welcome, Tara.
Thank you. Thank you for having me.
Our main topic for today's episode is hair loss. Hair loss is very common in women and men. It affects 40% of women, and it's slowly progressive throughout a lifetime. So once it starts, if you don't treat it, it progresses. Our first guest is Dr. Eric Carniol. Eric is double trained and board certified and has recently started practice in Summit, New Jersey. He is both a facial plastic surgeon and an otolaryngologist, which is commonly called ENT. Before moving to Summit, he was the acting chief of facial plastic surgery and otolaryngology at Milford Hospital in Massachusetts. He is an expert in nose and sinus problems as well as other issues related to ENT, in addition to his expertise in facial plastic surgery. He also has expertise in hair loss and hair transplants. Today we're going to discuss treatment of hair loss, and more especially hair loss in women. During their lifetime, 40% of women will have hair loss, and it's typically gradually progressive once it starts. Welcome.
Thank you for having me.
Yes, no, thanks for coming. So can you tell us a little bit about hair loss in women?
Sure. So as you said, about 40% of women will have hair loss, and even that number can be higher in their 60s, even up to 50%. And it starts even for many women just after puberty. And so it is progressive over time. And so many women will start to notice maybe a little bit of thinning just right on the top of the head, versus actually some women, especially after menopause, will start to notice hair loss more similar to men, kind of right in the corners up here, and even in the back, as you see for men, in addition to the standard female pattern for hair loss.
Now, does this continue, or once it shows up, it stops?
So over time, hair loss can progress. So even when it starts to be some thinning, then that thinning can progress to more and more loss until then the scalp becomes visible. Now, something that's important to know is that when you first start to see that scalp is visible, you've already lost about 50% of the hair that was there to start with.
That's an amazing number.
It's really impressive, and it shows just how far you've come already before it's silent, and now we're really working from behind whenever we see a patient with hair loss.
So what do you do since you're working from behind? How do you start? What does you start with?
So for many women, the key is actually just getting them a little bit better. So if we can just hide a little bit of that scalp show, then that's a win. We're not necessarily looking for home runs in every patient, although we try as best we can. So there are treatments such as starting patients on Rogaine. For many women, this can be helpful. Medications and hormonal treatments. So every woman that comes in will also get a medical workup in terms of their nutrients and their hormones. And then as well, we take a look at their pattern of hair loss and see if they're a candidate for any more definitive treatments, such as platelet-rich fibrin matrix, or even hair transplant when it gets to that extreme.
So are there different types of hair loss in women?
Absolutely. So the most common form is female pattern hair loss, which is very similar to men where they have male pattern hair loss, in that it's caused by the hormones, estrogen becoming testosterone, and then this super testosterone DHT, which happens right at the hair follicles. And so that's actually the most common form, and that's about 95% of male pattern hair loss, and about 70% of women overall have that problem for hair loss. But women also can have autoimmune issues, which are much more common, and as well hormonal and other issues that can lead to hair loss as well.
Now, I've heard that some women get scar tissue on their scalp. What goes on with that?
Absolutely. So there's two types of hair loss or alopecia. There's scarring alopecia and non-scarring alopecia. And non-scarring alopecia, that's that, as we talked about, that androgenic alopecia, or that kind of male or female pattern hair loss. But there can also be immune diseases that can affect the scalp, where actually the hair follicles don't just fall out and not regrow, but this tissue itself becomes involved and scars, where the hairs are just the innocent bystanders as the scalp is undergoing an invasive process.
And is there anything you can do about that?
So for scarring alopecia, actually, unfortunately, those women are very devastated by their hair loss because it can be very sudden. And so for those patients, it's really important to make sure medical treatments are working. So we can do things like making sure that they're up with their rheumatologist or arthritis doctors, making sure that they're in with their endocrinologist, their hormone doctors, and as well sometimes some steroid injections right into the scalp, very low dose, to be helpful for those patients.
Now, would you ever do this PRFM? I have to learn more about this.
Sure. So for those women with scarring alopecias, PRFM is really not applicable, but PRFM is great for the majority of women with that female pattern hair loss. And what happens as, sometimes when you see men with hair loss, you see that their scalp is very thin. And that's because they've not just lost the hair, but also some of that good fat, some of that good blood supply. And so, same thing that happens with women, even though it's maybe not as noticeable. So what we do with the PRFM, and some practitioners prefer PRP, but I think PRFM is actually a better technology, and I'll talk about that, is that we're putting in growth factors directly into the scalp. And so it's a patient who will come in, have their blood drawn from the arm, and then we spin it down to just the plasma and the platelets. And so once we have that, we'll combine it to form a matrix protein and inject it. So in that way, the growth factors will actually stay in the scalp for longer. So we don't have to use the high volumes and the high concentrations that some people do for platelet-rich plasma, but instead of the fibrin matrix, once it's injected, the growth hormones stay right in the scalp, which means then that the patient's going to get a lot better help with a smaller volume injected into the scalp, which is great.
Now, Tara, you've been involved in that. How big a deal is that to do PRFM?
Oh, it's easy. It's nothing. I mean, it's easy on my end, but for the patient, it's virtually pain-free. It takes less than a half hour of time, right? And we've gotten some really good results.
Out of the PRFM?
Yeah, absolutely.
Okay, well that's excellent. So now we have a PRFM demonstration, don't we?
Yes, actually, yesterday, Paul Carniol was a demonstrator on myself, and so I was the patient yesterday. Tara was nice enough to draw my blood expertly.
You did a good job. You were a good patient.
And so I would say, having been through the treatments myself, and thankfully I can, talk about from personal experience, most of the injections are somewhere in that 3 out of 10 kind of pain range where, they're a little bit annoying. It's kind of like if you ever accidentally pull a hair. But nothing, more than that. There are a couple of spots where you say, okay, that got me a little bit by surprise, but overall, pretty well tolerated.
Oh, we use a real little needle for that, because you're not going far in. You're just going into the scalp itself, and it's tiny. So that was quite brave of you yesterday, sacrificing yourself.
It's good to do the things that we do on patients so that we're able to give some honest feedback on what things feel like and what they look like. And
absolutely.
And so how good a patient was he?
He was pretty good. I would give you like a 9.5 out of 10. He was pretty good. I didn't see you grimace much. You complain.
So if we held up a score, we could hold up a 9.5?
I'll take it. That's Olympics.
Pretty good.
Tara, do you have any friends or people you know or patients who have had hair loss, and how do they feel about it?
I do. I actually have a few friends who have had some significant hair loss, and it's a really big hit on their self-esteem and their confidence. There's an age-old expression of a bad hair day, right?
Right.
We joke about that, but it's like every day is a bad hair day for some of these women. So, it's right there in front of you. It's what you're looking at every day, and it's really upsetting. So, I know myself over time, getting a little older, just a little older, but over time my hair has thinned, but it's not so problematic. But I do have a few friends who have some areas where it's really thin and noticeable. So,
well, first of all, you can't tell your hair is thin to look at it.
No, you can't tell, but you do over time. You notice that, my hair is definitely not as thick as it used to be when I was 17 years old.
Now, is it an emotional load for the ladies, or do they not want to go out? Do they want to stay home? What do they do if they start having hair loss?
I think, that's possible, but I think it makes them feel bad. I think you look at yourself, and as a woman, you try to look nice and do your best to look your best and to have this issue right in the front there's not really any way to hide it. So I think that's really upsetting.
So when they come in the office, do you do any counseling with them or discussions about this? Or
Yeah, we talk, and the patients are usually pretty candid about how it affects them and what really bothers them the most. By the time they walk through our doors, they're like ready to do something about it and ready to say, this is what bothers me and this is what I want fixed. So we talk about it, and I do my best in trying to make them feel better and hope that I know we can do our best to try to help.
now, what kind of measures can you do for the hair loss for the ladies who come in?
Sure. When the women come in with their hair loss, first, we know that they've been losing a lot over time, and for many women, they will try to be in denial for a certain amount of time. And as well, the women who are looking at their own hair, well, you also have hairdressers, and many hairdressers will not want to bring up this issue either, because they know it's such a sensitive and painful
It's
topic.
upsetting, right?
It's very
So there's not
upsetting.
an easy way to say, hey, look, you look like you have you're getting a bald spot in the back
Right.
of your head or something like that. So it's tough.
Yeah.
You don't want to offend anybody either.
No.
You want to help, but you don't want to offend. So I feel like there's a fine line.
And so really then by the time women are coming to us, they have noticed that significant loss, and we have, we're not just, fighting a tough battle, but we're definitely fighting from behind. So when women come in, actually we take a look at their scalp at the various areas of their head. And so different areas of the scalp may have different amounts of hair loss. And so as I said earlier, someone will have a little bit of hair loss just on the top versus more in the back or the corners. And so each area is individually examined. For many women, sometimes we'll need to perform a small biopsy, or we just take a little tissue, send it to the lab, if we're worried about immune diseases or other things like that. And then as well, we'll actually measure the hair counts to see what the hair counts look like in each area. This way we have an accurate measure of where we are. As well, we'll pull on the hair just gently to see how much hair pulls out. That's actually called the hair pull test. And so we can see how much of that hair is in active
So
shedding
do you pull
phase.
a lot of the hairs? How many hairs do you pull while you're doing this test?
It's just a small clump. So it's really just, just a few with your fingers and seeing how much comes out. And as well, you can look at the breakage of the hair to see the hair health. So all of these things together will help us make a plan together with the patient on where we are now, what workup we need to do, and then what treatments we need to do from there.
No, I'm going to interrupt you because I know you were going to ask a question, but is there anything that women can do to sort of prevent or slow the natural, thinning of hair over time? Is there anything that we should be eating? Should we be using a certain type of hair product? Is there anything that you recommend that can kind of help that before they're walking through our doors or?
So first of all, there are tons of products that are being marketed out there, and it's really tough to tell what's real and what's not.
Right.
Everyone's got their thing, especially in the last probably 2 years. I've seen a lot more products with advertising for hair loss for women, hair loss for men, and so first of all, it's really tough to wade through all of the garbage that's
Right.
out there,
Yeah.
because most of them are not backed by real studies. And so for hair treatments, there are a few different options. And as well, in terms of nutritional supplements, there are probably 2 good brands that are out there so far in that they've done good research. And by good research, I mean not quite to the level of where we have clinical trials, but where they've at least examined their outcomes with some sort of outcome measures.
Okay.
And those 2 things are Viviscal and Nutrafol. They're both excellent products. I think for some patients, one may work better than the other. They're available on Amazon. They're available off of retailers online.
These are supplements that you
These are
take?
herbal supplements
Yep,
to take.
okay.
Otherwise, living a nice, healthy lifestyle is also really important, making sure you have a good, balanced diet, and making sure you're just taking all the good nutrients that you should in a healthy diet. I think that's really important.
Now, what about lasers? Is there any laser things you can do that work? You see all these laser things advertised.
So there are many different laser therapies that are out there. They're all other devices that you can put directly onto the scalp, and people will wear them for different durations. There are some that you literally hold with your hand if you're want to get a good shoulder exercise, and some that you're attached to the wall, and others you can walk around the house. They actually do work nicely. For many patients, if you use it, then it works. And so it's a device that you can put on your scalp, what's called a low-level laser therapy, and it will put out a red light. It kind of looks a little bit silly, but it does work. And so by putting in the red light, you're increasing the blood supply to the scalp, increasing the little blood vessels, as odd as it sounds, and therefore that can work pretty well. There are different devices out there, and they have different warranties and different coverage, and so what's really important is not every device is right for every person, and so it's very important before buying one of these devices, because they can be a little bit expensive, because you can use them for years on end. It's important to get the one that's right for you.
Now, Tara, can you picture anybody doing this laser device at home? They're walking around with this laser on their head?
I mean, people go to great lengths to look better. So I suppose they could, but I'd rather them come in and see us.
The laser device actually that we carry in the office, actually you can put on, and it is attached to a battery pack, so you could even wear it while driving.
Oh, well, that would be an interesting look. But hey, listen.
Or just while in the house cooking.
That's fine too. Multitasking.
So if you don't cook, you can use it while driving?
Absolutely.
Okay.
Or you can use it at a sporting event?
That's good.
Isn't there like a baseball cap or something that goes over it?
It comes with a baseball cap, so actually it hides underneath the baseball cap. So you could conceivably get away without someone noticing. I think probably you could answer the door for the mailman without them noticing, but more than that, close inspection would show that you're wearing something on your head.
So you're wearing something unusual.
Yeah, that's interesting.
People might talk.
That's fine.
They might.
It's fine. If your hair grows and you feel better and you look better, who cares?
That works.
The nice thing is it's about 20 minutes a day, 3 times a week, and that's it.
Well,
So otherwise, if it's just literally 20 minutes a day, 3 times a week, most people can do that as they're going about their business at home.
Well, thank you for coming on our show. That was very informative today. If someone wants more information, how can they reach out to you?
So they can call our office or go to our website at drcarniol.com.
All righty, well, thank you.
Only 10% of us get enough daily exercise.
And that number is dropping.
Nearly 30% of us are overweight or obese. We spend 6 hours a day in front of a screen.
As a result, we now have a shorter life expectancy than our parents.
But give us the right start in sports, and we'll never stop. Learn how at active4life.ca.
Welcome back. We have with us Chaka Aman, who's going to demonstrate boxing for fitness with us. He's an excellent trainer over at Lifetime Fitness in Berkeley Heights, and many times he's training people in boxing as a form of getting in shape, staying in shape, weight control, and being physically conditioned. He sort of combines this with other conditioning as well. Welcome, Chaka, and thank you for joining us.
How's everything?
Good,
All
good.
right.
So the question is, tell us about this. Why would someone want to do this?
For many reasons, in my opinion. Boxing combines strength training, has a cardio, it has a big cardio aspect to it, reflexes, agility. It combines all the type of physical fitness activities that you need.
So what age group can do this? You have to be like 20, 25 to do
No,
this?
no, you can start, you can start as young as 5, 6 years old and go up to 75, 85.
Now, do these people have to fight?
No,
You know,
you don't
if
have
they're
to
doing
fight.
boxing, are we going to see them fighting
You don't
each
have to
other?
fight. You don't have to fight. It's just, it can be strictly for just personal training, getting in shape, keeping your mind, and there's also a mental component also as well, keeping your mind sharp, and your body sharp.
So they're not going to, at the end of training, look like Rocky Balboa does at the end of the movie?
No, you don't have to. Not at all.
You don't have to do that.
Not at all.
Now, what about diet? Can they eat anything they want, or should they adjust
Well,
their
diet
or-
will, diet will enhance your training, as in everything. I mean, if you clean up your diet, and it'll have a positive effect upon your training.
Now,
reflexes won't, it'll speeding you up.
okay, so you can take anybody and start them on this training.
Yes, I can.
So how would you start them? Just
I would start them, well, basically, for a complete novice who's never done boxing before, I have to start very basic. Your stance. First of all, I have to find out if you're left-handed or you're right-handed. If you're right-handed, you're going to stand this way. If you're left-handed, you're going to stand this way. So, and then I take you from there. Proper hand technique, proper hand positions, feet technique, movement,
now,
from the bottom to the top.
did they ever switch their stance from right
Yes,
to left? Or?
yes. Now, once you're proficient at your natural stance, then I switch you to the other stance because we don't want any imbalances forming. So I want you to be balanced in each stance. Yes.
So now if someone starts and they're rather sluggish, is that okay? Or
It's okay.
they're sluggish and
It's
they're
okay.
stiff and they're not moving well?
It's okay.
And
It's okay. It's okay.
So
You will get better. You will
so
get better.
how many hours of training or how many sessions would you say it takes someone to get a little bit better?
I would say at least a little bit better from day one. I would say by your third session, you will see improvement.
You'd see improvements.
Definitely by your third session.
Okay.
And the session can last anywhere from 30 minutes to 60 minutes.
30 or 60 minutes. How Charlie horse do you think they're going to be afterwards?
Not necessarily. All depends on the condition that they start in, and all depends on how hard I push them, and that determines where your fitness level is in the beginning. How hard I'm going to push you.
So how do you decide how hard you're going to push them? Do you look at them? Do you weigh them? What do you do?
No. I see how they move. I see if they pick it up quick. If they pick it up quick, I can push them a little harder. But I'm not trying to kill them. I'm just trying to show them the basic fundamentals first, and then once they have that down, then we progress to advanced techniques and stuff.
Now,
like that.
did you ever do any boxing yourself?
Yes. I've been boxing for the past 16 years, and I still box. I still spar. So.
And you do that at a boxing gym? Or?
Yes.
So
I have a trainer who trains me myself.
You do?
Yes.
And so do you feel this is adequate for someone, what you're doing, or you think it's good enough or too good? Or
No, it's perfect. It's perfect. Perfect for anybody who's interested in it.
Okay, so that's
You
great.
definitely benefit from it. Definitely.
All right, excellent. So you brought someone today to do a demonstration of the training?
Yes.
Okay, that's great. And who'd you bring
And
today?
this is one of my major clients. Her name is Alyssa Stanek, and she's been boxing with me since 2015.
So,
Right
she's one of your students. Good to meet you. All righty, okay, so I'm going to let you two start the demonstration then.
Okay. All right. So now Alyssa is actually left-handed. So being that she's left-handed, she's going to stand with her right foot forward. Yeah. She's going to stand with her right foot forward, right hand here. Now, in boxing, the most important thing in boxing is keeping your hands up. So you want your hands right underneath your eyeballs, and you want your elbows protecting your ribs. So that's the most important thing, along with your foot placement right there. So now, once you have that foot placement, we're gonna start off with the most basic punch in boxing. It's called a jab. Now, because she's left-handed, it's gonna be a right jab. It's the most basic punch for her. So the jab is right there. Nice snap to it, full extension, right there. Now, next basic punch is a left cross because she's left-handed. It's a power shot. And notice her hip and her foot, they pivot. That's where the power comes from. Nice. Third shot is a right hook. Again, she pivots. Shoulder, hip, foot. Nice. Fourth shot, left hook. Now, when she's punching, the hand that's not punching, protecting the face. Nice. Fifth shot, right uppercut. And the sixth shot, left uppercut. So those are the 6 basic punches. We have other punches, but those are the 6 basic punches. Now we're gonna do a little combination. We'll do a 1, 2, 3. Right jab, straight left, Right hook. One more. Now, in boxing, it's just not about punching. It's also reflexes and being defensive. So now, when you punch, you have to expect to be punched back. So if somebody punch back, you want to move your head. So what we're going to do is she's going to give me a right jab, and she's going to slip my counter punch. All right? Jab, slip. 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 Now, after the slip, you want to take advantage of that slip, she's going to come back with the right hook. Nice. One more. Perfect.
That was an excellent demonstration. I want to thank you all for joining us, and I want to thank Chaka and our other guest, Dr. Eric Carniol, for being with us today. We look forward to seeing you again on HTTV.